Mille mágad a caihiúlaigh agus míle buchas a hísigh agus a furin as teachtasteach an seo inniu agus a chuid chur láthair freisin. I'm going to focus on probably two different areas if I can, but I think, and I don't say this, Taoiseach, in a combative fashion. I genuinely say it in a measure of trying to kind of tease out with some of the problems that exist in government at the moment. But there seems to be, if you look at housing, if you look at healthcare, if you look at the cost of living crisis, if you look at the migration issue, there seems to be a big problem with competency at the heart of this government. And you know, I think the government is very able in many ways in trying to bat away allegations of inertia, bureaucratic inertia in housing and health and so forth. But in all the key performance indicators that are visible from all of these areas, Taoiseach, you know, a man of your intelligence has to maybe secretly admit that the level of progress is minimal, and actually the government is going backwards in many of these areas at the moment. So if we look at the healthcare system currently, you know, record waiting lists for operations, record waiting times in A&Es. You know, we had 120,000 people on trolleys last year, many of them old, many of them infirm, thousands of people waiting over 24 hours on a trolley to actually get treatment. In 2021, Taoiseach, we had 105,000 adverse incidents in the health service. This is where the health service damaged 105,000 people because of some manner of ill treatment or mistakes or etc. The state has paid €2 billion in negligence payments in a period of 5 years. And so negligence payments are made because people physically suffer due to adverse incidents in the health service. And that's a cost that's coming out of the taxpayers' pocket, money that should have gone in to the health service. And even today, I'm getting texts from the hospital in Navan to say that last night, 39 patients were triaged in Navan and still waiting to see somebody to actually, a doctor to see them, to see could they help them with regards to their illness. And that's not even counting the people who are outside in the waiting room before they get triaged. And we have this incredible situation, and I don't know whether it's an intellectual fashion or what it is within the HSE, but you know, that idea that with a population increasing, with population getting older, that we should close more A&Es. You know, and then on top of that, we have an ambulance bypass of Navan coming in, leading to Drogheda becoming a car park for ambulances, where ambulances are left for 5 hours waiting to deposit their patients, leaving no ambulances available for Cavan, Monaghan, Louth and Meath. At a time where the figures are saying that ambulances are less likely to be able to fulfil their targets in getting to serious illnesses within the time frame. And it just seems like the decisions are being made against the flow of evidence eternally in relation to the health service. And on top of that, Taoiseach, if all of this was happening at a time of a funding crisis, of lack of money, people would be able to say, well, but there's very little we can do. But we're spending more money in the health service than we ever did. Ireland has the biggest proportion now of our national budget spent on the health service. So is there not an absolute crisis of competency at the heart of the running of the health service? And we take that first if we can.